Monkeypox continues to spread, but health experts are concerned we are not getting the full picture on case count or information about those cases. Right now, there are about 2,900 cases in the U.S. We've just learned 12 of those are in Wisconsin. But the head of the CDC says that's likely an undercount. And of the cases that have been reported, the CDC only has detailed information on about half of them or so. So the World Health Organization has declared yet another global emergency, this time for monkeypox. But as of right now, it hasn't been declared a public health emergency in the U.S. specifically. And to talk about the wide range of health topics with us, including the spread of monkeypox, is the medical director of infection prevention at UW Health, Dr. Dan Shirley. Dr. Shirley, we appreciate you taking the time to speak with us this afternoon. I want to start with the topic of monkeypox. Of course, that's a big topic right now. With nearly 3,000 cases in the U.S., should we be concerned at this point? And do you believe that this could cause a public health emergency similar to COVID here?
Well, I don't think that the average person needs to be highly concerned. It's more about being aware and kind of following along that cases are rising. And that's in a way a good thing because we want to know how many cases there are and sort of do the contact tracing to find other people who are exposed and might be at risk. The World Health Organization declared it a public health emergency, which is a big step and a good thing to get the resources out so we can really start to get on top of this around the world.
Yeah, it certainly did open up some of our eyes. And at this point, Doctor, can you tell us how we can protect ourselves from getting monkeypox and what are the signs that we need to look out for?
Well, the primary means of spread of monkeypox is prolonged close contact. So it really requires that you have this, skin to skin contact with someone with monkeypox. And so it's really right now more of an awareness about where are lots of monkeypox cases happening and what activities am I doing that could put me at risk? And really, even more importantly, just monitoring for the symptoms of monkeypox, especially if you have some of those risk factors.
And in your line of work, are you seeing any similarities to COVID? Of course, we're talking about, this public emergency, but as far as symptoms, what you're hearing from possibly patients, are you hearing anything that's kind of just similar to one another?
Well, there are definitely way different diseases, but the similarities are just some of the sort of definitions and topics that we've been talking about in public health for the last couple of years. The difference for monkeypox is that we have some time to do this contact tracing and find those people that are exposed and do something about it. Enough time to give a vaccination for those people exposed. We have some treatments that are thought to work up front. And so generally speaking, things are different. The one thing that is a little bit similar is monkeypox starts with some non-specific symptoms that could, be very much like COVID, like fever and muscle aches and fatigue. The difference is that you develop a rash a lot of time in monkeypox and you can get this swollen lymph nodes, which is not part of COVID.
And with that being said, the first U.S. case of polio in nearly 10 years was announced in New York. This is something that many of us get vaccinated against early. But with this new case, does this strike a concern for those who aren't vaccinated?
Well, yes, I think it's more of a concern just for our public health system as a whole and how we've maybe wavered a little bit in our vaccination coverage. Polio is a very preventable disease. In fact, over the last many years, we've been talking about eradicating polio. But that requires, broad vaccination of a big population. And when that sort of gets a little bit lax, we see cases crop up every once in a while.
Oh, yeah. All right. Dr. Dan Shirley with UW Health. Great to have you with us and your insight here on the News at 4. We appreciate your time.
Thank you.